Hello，大家好，我是 Kitty，欢迎来到我们的这个 Vlog 的第5期。今天呢，特别的想跟大家讲一下近几年特别火的一个话题。这个话题呢，也是我们这个女性同胞特别关注的一个话题。这个话题呢，就是我们的这个产后康复，或者叫做盆底康复。我自己个人呢，会就是比较倾向于骨科和运动康复这一块，所以这一期呢，我给大家请到了一个大咖。这个大咖呢，就是我们的朱莉老师。认识朱莉老师呢，也是因为这个陈远老师的原因。因为在我读 DPT 之前呢，我一直在跟陈岩老师工作，然后呢，也由此接触了盆底康复，然后也因为陈岩老师的原因呢，我也认识了这个朱莉老师。我今天跟朱莉老师做的这个，通过一个案例来做这么一个 vlog 呢，主要是想让大家能够清楚或者理解到这个盆底康复，它其实也是一个我们叫这个 holistic approach，就是它是一个非常它不仅仅是盆底，它也有很多就是骨科其他的东西。这其中呢，朱莉老师呢也会根据就是这个案例呢来跟我们就是更进行就是比较多的一些科普上面的一些知识的讲解。也是希望通过这么一个小小的 vlog，然后呢，让我们的这个妈妈们呢。姐姐们或者是小妹妹们呢，来就是更好的了解自己的这个身体，或者说是自己出现了一些问题，可以通过什么样的方法来解决，或者是找什么样的人。因为这个市场上大家也知道，就是在这个女性健康这方面做的也是，应该用一个成语，应该叫做鱼龙混杂。所以这一次做这个 vlog 的原因呢，就是想就是给大家更加推广一下一种比较科学性的一种 approach。那在接下来2分钟呢，我会再跟大家简单的讲解一下这个案例，然后我们就可以把这个朱莉老师连线进来，然后呢，我到时候会让朱莉老师自己先介绍一下她自己。
All right, we have Julie right here, and she's in California. And I'm just going to ask her to introduce herself a little bit before we get started. All right, Julie, you can go ahead.
Hi, I'm Julie Gillespie, and I've been a pelvic floor therapist for over 30 years. And I worked at USC for about 10 years. We started a comprehensive continence center and worked with patients who had multiple problems, not just pelvic floor problems, but system problems, cancer, things like that. And I also had a women's health OBGYN practice. So I've done a lot of things in.
You got to mention that you're the one who created the nation's first women's health program.
Okay. Embarrassing. All right.
We could talk a little bit more about prolapse, since that's a lot of people are worried because having something in your vagina, it's just strange.
It's strange.
Yeah. So do you want to
Sure. I brought my pelvis. Dun, dun, dun.
All right. Yeah. So maybe just starting with okay, how does prolapse happen? Why does it happen? How frequent does it happen? What are the risk factor associated with it? It's all you.
Okay.
Yeah.
So there was a Canadian study recently, and they said that it was 80% of women, or 70% of women had symptoms. 80% of women had a uterine prolapse, and another, what was the other percent? I have to look at.
89% had the uterine prolapse. 70% had the rectal soleus.
How much was the rectal? 70.
70, and then 80% were symptomatic.
And okay, so so that's a lot of problems. And that was 1 year post, and it didn't matter if they had a C-section or a vaginal delivery. So there's no correlation between the type of delivery you have and whether or not you have a prolapse.
Mm-hmm.
The only correlated factors are if it's been a multiple pregnancy, and other comorbidities like diabetes and obesity. And IVF, their finding is also correlated because all the hormones that increase the whole system and how it has to work harder and work differently, they find that there's more incidence of prolapse with patients who've done fertility treatments as well. And when you think about, so there's anterior and there's posterior prolapse, and there's grade 1, 2, 3, 4. So an anterior prolapse is either the bladder coming into the vagina, this guy right here, because he's the first one in the front, or the uterus, part of the uterus coming in. And those are usually fixed by exercises, or sometimes the use of a pessary, which is an internal device that is like the bridge and holds everything up so London Bridge doesn't fall down. And then the grade 3 and the grade 4 prolapses are more of like when the small intestine comes into the vaginal vault from the middle to rear section, and that's called an enterocele. And then a rectocele is when the anterior wall of the rectum meets the posterior wall of the vagina, and so there's a collapse there, and that's when you see differences in the length of the vaginal vault, because the rectum is coming into it from the behind, so you don't get length that way.
Okay.
Make sense?
Yeah.
Okay. And the studies aren't really conclusive about whether pessaries or exercises are one is better than the other. But clinically, we see that patients get better with exercise. So clearly there just hasn't been enough studies.
Do you see a lot more prolapse in your practice
I see,
compared to another women's health stuff?
I work in 2 practices, and one we get a lot of referrals from colorectal surgeons. So I see a lot of rectoceles in that particular practice, but in my practice it's mostly OB. So I see I see a fair amount. I wouldn't say I see 80% or 90%. It seems like a lot of the referrals I see, they're more concerned about their DRA and how their belly doesn't get flat. There's more of a cosmetic thing than a functional concern of the vagina. And again, I just think that it's because people don't talk about it, and they kind of feel ashamed about it.
Right.
Like if they brought it up, I might look at them differently, or I might think of them differently, or that whole area is like a taboo area. We don't talk about it, because somebody might know my whole life or something. It's weird. It's like a religious taboo kind of thing, and it's kind of unfortunate because it's something that so many women get, and it's so easy to treat. It's a weak muscle. You strengthen it just like any other muscle.
Yeah, I think it seems very mysterious because you don't see the muscle. So so people have, I think that might be the reason for it. Yeah, they think it's a harder practice than musculoskeletal or ortho in general, because you don't see it getting stronger. You can only feel it to get stronger.
Right. I think that is true. That is difficult to measure. It's difficult to measure. I think the trans abdominal ultrasound is really a game changer, because you can look at width of the muscle. You can look at the right versus the left. I mean, it's really helpful in objectifying it. And you can also look at the pattern of breath, whether they're lifting up or bearing down, but a test is a test, and they can't take it with them, and they can't do it at home. And I know they have those home little devices that you can hook up to your phone, and you can do the biofeedback and you can see if the muscles going. But the problem then is that you may not learn, right? You may not learn the activity. You may just learn how to perform for that device. And so it has to be part of their functional activities of daily life, where they don't need a device to show them how to do it, but it's already hardwired, and that's the trick of a PT, is trying to get them to make it, second nature.
So, so I think on here we also talk about, besides the pelvic floor exercise, what another exercise can be done to help prolapse.
Yes. So I think what we talked about was working on the posture and getting the right alignment, so that all day long she's not increasing that angle of her tipping her pelvis forward, and because you have to think about where does the pelvis sit all day long, and if it's sitting forward like this, then she's putting more pressure and there's going to be more prolapse. So you have to talk about posture. You have to talk about strain, and where you're having strain, you're trying to get the patient to balance things out a little bit more, because this is a system out of balance, and that prolapse didn't just happen like lickety split overnight. It was carrying this baby and there was a lot of weight for a long time, and so everything got a little stretched out. But you can't just strengthen it. You have to realign and make sure that outer core is connected. So posture, and talk about her drinking more water. I was trying to get her to drink more water and keep track of it. She was drinking like a glass every time she was nursing, so that was good. But she was still going to the bathroom every like 60 minutes. So I said, keep drinking the same amount of water, but try to go to the bathroom less frequently, so you're storing more urine and your muscles are getting stronger that way, and you're just getting more control. I think there's a sense of the body's just let go and there's no more control anymore. And if she can start taking control with what she's drinking and how often she's going to the bathroom, then she'll feel like she has a handle of it better.
So on top of that, are there any exercises that should be avoided?
Yes. So there's a certain, like, she had an app on her phone where she was doing exercises, and they were like jumping jacks. And I'm like, no. Any high intensity stuff, she probably shouldn't be doing. So running, jumping jacks, anything where she's, perturbating, jumping, moving up and down and not having support. If she really, really, really wants to continue jogging, then she's got to wear a pessary or something, because every time that she's jogging, she's putting more pressure down there, and without that support, that muscle support, it's just going to make the prolapse worse. So she could do like a squat, and she could like raise her hands and keep her feet on the ground and not jump up and down instead of a jumping jack. And while she's squatting, she could think about turning on the TA and really having control, slowing it down a little bit so that she knows she's not, there's a point where she could feel it. I had her standing and doing some activities, and she could feel the prolapse migrating a little bit. And I said, well, rotate your toes out, externally rotate your hips. And then she could feel everything coming back in. And so it's like she has to look at her list of exercises, and anything that increases the prolapse, she has to avoid. Plank position, for example, is okay. Down dog is okay. Those are all okay positions. But if she starts to do like single side plank, she's probably going to feel too much pressure. So you kind of have to look at what they're doing their exercise routine and then modify it accordingly. But yeah, absolutely, jumping jacks are out for now, and running to catch your 3-year-old, that's also out. You know.
One with prolapse be aware of after getting discharged from PT?
So there's going to be setbacks.
Mm-hmm.
It's going to ebb and flow. And if they have something come up, like let's say they retile their bathroom and they have to unload the car and there's a bunch of heavy tile, it might come back. You know, they might exacerbate it. Or if they have a cold, they might exacerbate it. That doesn't mean it's the end of the world. They just have to go back to more awareness of, okay, how do I turn it on? How do I keep it from prolapsing? How do I engage and keep engaged? And you know, it's not this even a year post, there may be setbacks.